Welcome back to a brand new episode of Private Parts with me, Liv Bentley. This is the podcast where nothing is off limits. Today we have a very special guest who knows everything about cosmetic surgery, and that is Dr. Dan Marsh. Welcome to Private Parts.
Thank you very much.
And I'm sure you've seen a lot of people's private parts.
One or two, I have, yeah.
So, the good surgeon. Did you always want to be a surgeon?
Yeah, I've always, ever since school, I did really enjoy biology and things like that. And then
Dissecting different things.
Yeah, and then enjoyed that, and then went into medicine. And then as you go into medicine, you do different things. So you do general medicine, surgery, and then you find the bit that interests you the most.
Boobs.
And then, surgery. So we just surgery, we operate on everything: breast, tummies, ears, face.
Oh my God, there's so many questions I want to ask. And so wait, what do you specialize in specifically?
So I kind of do everything. The most common surgery is breast surgery, abdominoplasties, so tummy tucks, body contouring, do some facial surgery, blepharoplasty, labia.
What's that?
So,
by the way, I'm a bit thick, so you're going to have to explain all these different things to me.
Blepharoplasty, upper eyelid surgery, and lowers, so you can fill out the tear troughs, you can take away the loose skin.
That's what I think I'd like. No, I'm going to get addicted. This is the problem though with surgery. Everyone now, but it's an obsession.
We do. You are the patients who you see that in, the ones who have massive weight loss. So patients who've lost loads of skin. So you basically sort out their breasts, sort out the tummy, sort out the arms, sort out the upper back, sort out the face, and they kind of move on and on. Eventually, I've got one lady, and she's now just moved on to her lower legs.
Oh my God!
And I always say you've got to know where to stop.
What's the most common age of someone that comes to you? What's your patient?
Some mums usually. So
really,
yeah, people who want to reverse the effects of childbirth. So,
see, I'll be honest, it puts me off childbirth.
Those are the most common patients we have. Breast lifts.
Yeah.
When you breastfeed, the breast gets fuller, drops over time.
So if you have a boob job, then you get pregnant, have a baby. Your boobs, what happens? Do you then need to get them redone?
So not always. No, I've had some patients who've had breast implants and then have had 3 pregnancies and things are fine.
Yeah.
Other patients have 1 child, the breast gets huge.
Yeah.
Drops, and then you have to come back and do a breast lift or tighten everything up again. So it's so variable. Some people do really well with it. I think probably what it has to do with is how much natural breast tissue you have.
Right.
If you start off with a small amount of breast tissue, and then you become pregnant, then the breast is not going to change that much.
Do you naturally over the years lose breast tissue?
It drops.
It just hangs down on your hips.
You almost get more actually. So patients who've got large breasts, over time the breasts will get larger. With gravity, with age, much like the face drops, the breasts will drop. And so breast reduction is actually probably my most common surgery that we do. Yeah, it's a great surgery.
Oh my God. You say a great surgery, it's just making me feel a bit queasy a bit.
Oh, no, you imagine carrying around
all that weight, I know.
1.5 kilos of extra skin or breast tissue on the front of you, and it's a massive relief, improvement on back pain, shoulder straps, what you can wear. You can't exercise if you've got huge massive 2 kilo breasts. Yeah.
See, I lucked out with the itty bitty titty committee over
that's what everybody wants,
Yeah, so, small boobs.
Yeah.
Will you say that? I don't know. Katie Price is knocking about with a couple of her big jugs.
Yeah, but she's not done much for plastic surgery. She's had a lot, but it's not.
I mean, just what does that to one's body if after 2 breast boob jobs? What is that actually doing to you?
So the skin stretches. So the number one thing to understand about breast implants is it stretches out your skin, right?
But
so if you go too big,
you can never come back again.
You have to cut the skin out and do a breast lift to take it back again. So some people will do all right if you have larger breast implants and you take them out. Yeah. Very occasionally the breast will contract nicely and it will look fine, right?
Yeah.
So you can get away with it sometimes, but it's always a little bit lower. So if you stretch your skin ridiculously with 600, 700, 800 cc implants. 800
cc, say that again. What does that mean? That's the weight of the...
So if you think of a litre bottle, 800 cc is, is 3/4 of a litre, right? So it's massive. And it weighs 800 grams. So you've got 2 of them.
I just couldn't think. Can you imagine lugging that around with you?
No, it's heavy. They're
Have
actually
you,
heavy.
Has anyone ever come in, suggested a boob size and you've gone, you know what, honestly, that will not work for you?
All the time.
Really?
Yeah, because you can't. But that's the thing people don't understand about surgery is they come in and they say, "Oh, look, I want to have this implant. My friend's got 500 cc," and I'll say no.
Really?
Yeah, because I know that if you put a massive implant in, 5 years' time, it's going to look awful.
Yeah.
So you have to just be honest and realistic with patients. I would say I probably turn away about 20% of patients.
Really?
Yeah. Because their
that's so good though, because I think that's not fully normally common, is it? Because a lot of people, I would imagine, see the paycheck and they think, fuck it, I'll shove those puppies in there.
I don't know. Not if you go to a proper surgeon
Yeah.
who's, well recognized, well trained.
What's the different types of boob jobs you can get? Because obviously you get ones under the muscle. Is that right?
Yeah.
And
So
then,
the two main types are
Okay.
under the muscle or in front of the muscle.
What's the difference?
If you go in front of the muscle, I mean, it's going to take a massive explanation, but if you go in front of the muscle, you're going to see or feel the edge of the implant. So you get rippling, right,
Yeah.
particularly the implant. If you go behind the muscle, it's always more natural.
And then do they naturally drop then over time?
Yeah, naturally, but only if you don't put an implant that's too big, it will look great. I do a dual plane, which is like a mixture of the two. So it's kind of, you can manipulate the breast, you can do an internal breast lift, you can like make it look really nice. You can, because no one's breasts are identical.
Yeah. Oh, okay.
So you can manipulate them differently to make them look more similar.
And then what is this chat I've heard recently about people having filler put in their boobs?
Yeah, disaster.
Absolute
disaster.
But so like with breast cancer, are people not semi-nervous? Like, obviously that doesn't cause it, but that's a risky thing to do, is it not?
Yeah, so there's two types of filler. The one is semi-permanent and the one is permanent. So the ones that are semi-permanent obviously dissolve over time. The real problem is the permanent filler. So when you fill up a breast with permanent filler, it just causes scarring, lumps, irregularities. It's horrible.
Surely you just get a boob job then. Why would people even consider getting a filler?
It was fashionable a while ago. There was a period about 10 years ago.
But what, just to raise the top bit?
Yeah, just to make it. Well, people didn't want to have the surgery, so they go to somebody who's maybe not licensed, not regulated, and they fill the breast with filler, right? And it just looks terrible. I was up near Manchester the other day on the motorway.
Yeah.
A lorry drove past with a big sign on the side saying "filler, bums, breasts, lips."
No, I said this to Botox the other week. People are losing their minds. But but I don't understand why I get it for a quick fix, and I suppose, and not everyone has the money, but really, would you put your life on the line for a bigger ass?
Well, people do.
But it was a woman who died from a Brazilian bum lift. Why is that so dangerous, these Brazilian bum lifts?
So the thing with the Brazilian bum lift is, in the old days, what people used to do is inject the fat into the muscle.
Right.
So if you've got the gluteal muscle, the bum muscles,
Yeah.
and you have the fat outside of that and then the skin, if you inject the fat into the muscle, there's a risk that you can inject the fat into one of the veins. There's a big vein that runs through it, and then it goes into your lungs, and it can be fatal from that.
Not that I was going to have one, but that's really put me off, obviously.
Yeah,
I'm just buy those padded leggings, with the fake arses in. That will be fine.
They're much better.
That's way better. And cheaper,
better.
Actually.
And you can take them off when you don't want them anymore.
That is true. Why was it that you originally got into boobs? I mean, that sounds so weird saying that. It was a young age. No,
boob jobs is just part of the whole of plastic surgery. So it happens to be the most common plastic surgery that's done in the UK. So it's not that I went into it because I want to do boob jobs. It's because it's a part of what I do. So combined with abdominoplasties, breast lift, and things like that.
Yeah.
So my training was about breast cancer reconstruction.
Okay.
So I spent a lot of time rebuilding breasts. For women who had breast cancer, we take flaps from the tummy, we'd put them into the breast and rebuild it.
Yeah.
And I got a good feel for it and what looks nice and what, and learned a lot about that. And it can make a massive difference to people's lives.
I think as a woman, it would be
the confidence that people get is I mean, I know it sounds really frivolous, but it really does make a huge difference.
No, I would imagine it does actually. I think it's important. I think if you've gone through something really tough as well.
I have a patient, she's like 20 years old, got breasts down here, lost a lot of weight already. She is one of my happiest patients. We lifted them up. Yeah, I didn't put any implants in, just lifted, reshaped it all.
So when you lift, you do the skin at the top. You basically like pulling up a pair of tights, and then you just chop the top off.
You chop the bottom off. So you basically, if you chop the top off, you get a scar on the top. So you lift it from underneath.
Yeah.
And then you fold it, and you can take the skin.
Do you take the nipple off?
You cut around the nipple and you lift
and then put it back on. Sorry.
So you never. Yeah, people always ask, you cut it off. You maintain the blood supply to it and you lift it up. But actually, what you do is you reshape the breast.
Yeah.
And you stitch the breast tissue that's down here. You stitch it up here.
Oh my god.
And you can use your own breast tissue like an implant. And that is the best way of doing it.
Surgeries last?
It's about 2 hours.
It's pretty sharpish, actually, isn't it?
Breast reduction's 2 hours. Breast lift 2 hours. Breast implants is about an hour.
God, that's
so
quick.
I mean, it's important to keep surgeries shorter for safety.
Yeah.
The longer you're asleep, the higher the risk.
Can we talk about this anaesthetic thing? Because I put a Q&A up last night about people ask questions. What is the reason people are against going under? Death.
It's the number one thing that people are worried about. Then people say that they're not really worried about the surgery. They're worried about the anaesthetic.
What's the percentage of people who don't wake up from anaesthetic?
Very, very low. Like you're more likely to be hit by a bus crossing the street than you are from dying from having an anaesthetic. I mean, that's
the thought of lying there awake while someone is not touching me up, sorry, because that's not what you're doing, while someone is doing something is terrifying.
Yeah, and that's what people are worried about. But actually, there's different types of anaesthetic. There's local anaesthetic, so you're awake. There's sedation, where you're kind of in, out, half awake, you don't remember anything, you don't move.
Yeah.
And then there's general anaesthetic.
What do you do the most of?
We use general anaesthetic.
Yeah.
But it's the same substance that we use for the sedation.
Okay.
So we just give a little bit more. And the whole difference between the two is the airway control. So you control people's airway when they're asleep. So
Right.
it's much, much safer.
How often have you had anyone wake up during a surgery?
Never.
Never?
Never once.
Oh my God, interesting.
So the thing with that is in some anaesthetics, what they do is they paralyze patients. Okay, so you can't move. Right? You give a drug, which means that you can't move. And then you give another drug to make you asleep. So the risk of them waking up, the thing people are always worried about is that they're paralyzed, they can't move, and they wake up, which means that the paralysis is working, but the anesthetic's not working. But what we do is
My heart's slightly racing if I'm not thinking about it.
But we don't paralyze patients.
Yeah.
Okay, and we use a BIS monitor, so you monitor how awake they are. So it's entirely safe. There's zero risk of you waking up during the anesthetic.
Realistically, if someone wanted to, could you be awake for a full facelift?
So you can be awake for a facelift because you can use local anaesthetic for that. So what you do is you can inject local anaesthetic around the nerves, which means that you can't move and you can't feel anything. So just in the face.
I think that's worse. I think that is worse. What in your eyes, just going back and forth, watching the scissors coming back.
But
they
often combine that with a bit of sedation. So you're a bit out of it. You're not with it. You don't really remember it. But equally, you're not having a general. So some people would say that that's more straight. But the recovery is quicker. You wake up quicker.
Interesting. Yeah. There's a deep plane facelift. What is that?
So a deep plane facelift is where you go. So if you think of the face, you've got the skin.
Yeah.
You've got the SMAS layer, which is the layer under the skin, and a deep plane facelift is where you go deep to the deeper layer. So the SMAS layer, which is the muscles, and it's continuous from your platysma muscle all the way up to the muscles in the top of your head. With a deep plane facelift, you go underneath that, and you resuspend that high.
Yeah.
So there's no tension on the skin. So actually, you don't remove that much skin.
It's just
but
tightening
it tightens
the
everything
muscle.
underneath, and it's a great surgery in that it lasts a long time.
Yeah.
You remove less skin, there's less tension on the skin, so the scars are better.
What sort of age do you get of women who are looking to get that done?
It's becoming younger and younger.
But what do we think? Do you, in your honest opinion, do you think people have slightly gone a little bit wild now because of things like Instagram filters and face apps? That now everyone's just like, I want to look a certain way, and younger people are getting stuff done.
There are absolutely, particularly with facelifts. I think facelift is designed for women who are older. The face has dropped.
What's the youngest person who's come to you asking for one?
I've had a lady in her 30s for a facelift.
She
had a skin condition called Ehlers-Danlos, where the skin's quite loose. But I've also had patients asking for it, and I just say no because unless it's indicated, it's so important that you don't, because once you've had surgery,
you can't undo it. Really,
if you go back for a second surgery when you're in your 40s or 50s, it's a lot more difficult because it's more scarred. Things are not where they are, and if you have to be more, and the risk is higher because the scar tissue around the nerves, you can't quite see what's so easily. So the real problem with women I had a lady the other day for a facelift, and she'd had lots of non-surgical treatments, so radiofrequency, things like this, and the skin was so scarred underneath.
Radiofrequency, remind me what that is?
So that's where you put a probe just under the skin, and it heats the skin underneath.
Is that like HIFU?
HIFU is high intensity focused ultrasound.
Okay, that's fine though, right?
So is that what you've...
Yeah.
No, HIFU is great.
That's fine. I can get a facelift.
Obviously it looks amazing.
Thanks.
So you have to be really careful with having had too much non-surgical, because if when you need to have a surgery treatment, or a surgery, then it makes that a lot more difficult. And she denied to me that she'd had any treatment.
Oh no, don't. So what happened when you got her?
You certainly have, because it's properly scarred.
Really?
Yeah.
So what do you do about that then?
We just carry on, but there's a limit to how much you can do with the dissection, and you can't do quite as much as you would want to do.
Before, if someone's going to go in to have a facelift, do you tend to get them? Do people tend to remove any or dissolve any filler that they've got?
Yeah, it's recommended to do that. I mean, I would ask patients to do that, but sometimes you'll find filler in there that they say they've had it dissolved, but actually you'll find these like globules of filler under there, or some filler can't be dissolved, like the older ones. The more permanent, like Radiesse and things like this, that are more permanent fillers.
Oh my god!
And also patients will lie to you. You find threads in there. You lift up the skin. There's all these lengths of suture.
God, this is like a horror story.
Yeah.
Can you sort of scan someone's face to see what is going on under there?
You can ultrasound, and if you're really worried about it. But if somebody says to me, "I've not had any non-surgical treatments," then I'll believe them.
Can you tell pretty quickly looking at someone if they've had something done?
Not always. I mean, the best surgery is the one that you can't tell.
Yeah.
So like a really good facelift is very hard to spot. If you look for it, you can maybe see it, but sometimes the deep plane, particularly the scars, are so good these days that
roughly how much does a facelift cost in the UK?
It's hugely variable. So people will pay anything, charge anything from sort of I don't know, £9,000 up to 60, £70,000 in the UK.
Bloody hell.
The US, some surgeons charge $200,000.
Oh yeah, it's a fortune.
$250,000.
Why is that, if I'm honest? Just because they can, or?
Yeah, I think there's a certain demographic of people who want facelifts, you know, and then it's obviously a very sensitive area in terms of you want to go to the best if you're going to have your face done. And those surgeons that are doing that can put their prices up higher because the demand is there.
Yeah.
It's very much demand-led, you know, like a lot of women in their kind of 40s, 50s who come for a facelift.
Yeah.
They're fairly affluent, you know, and the surgeons can charge that. And they have a big waiting list, so you just put up the fees until people stop coming.
But then you get obviously all the cheap ones, which are all the unregulated.
Yeah, if you go overseas, you have a facelift for £3,000-4,000. But why you would do that?
It's terrifying, isn't it? But that happened to a girl I know. She went to Turkey to have her boobs done, had them done, came back absolutely fine, then started getting quite sick. They fucking harvested one of her kidneys, and then she went back and the place was non-existent. For anyone listening who is considering going to Turkey, what kind of things should they be looking out for? Not that I recommend going to Turkey, obviously, but would you advise people generally not to even consider doing that, even if it's the cheaper option?
So the risk of going abroad for surgery is, of course, if it doesn't go well.
Yeah.
You know, I think that the kidney story, I've heard that as well. And I mean, I find that impossible to believe.
Really? Do you not think that's true?
I don't think so. I don't know.
But this is the other thing. If you wake up without a kidney, you are kind of, you feel a bit funny.
I can't believe there would be any surgeon or any doctor in the world who would do that. I mean,
really?
Doctors generally are kind of...
But a bit dodgy on the black market. Kind of how much would a kidney go for?
I have no idea.
Listen to the podcast doesn't go well. You see my liver somewhat.
But I think, I don't know if it's true or not, but so if you're going abroad for surgery, you've got to be sure that the aftercare is there, you know. Yeah. So complications after surgery can happen to anyone.
What sort of complications are there, like the biggest ones?
So the biggest thing that people come back for here in the UK is wound breakdown, infections, seromas, hematomas, so bleeding behind there. Like the NHS, you know, has a lot of patients that come to it who've had surgery abroad and have problems, and they expect the NHS to sort it out, you know. And actually, if somebody's sick, then they're going to sort it out.
Yeah.
But then you're left with an open wound or chronic care, and you know, who pays for that? You know, the patient's chosen to go overseas or somewhere.
So it's kind of their own fault, to be honest.
And often the complications happen in patients who are overweight, you know, so who are smoking, who've got risk factors, you know. So I won't operate on patients who weight is too high, who are smoking, or you know have.
Oh, great!
Have
so I'm off your list then.
Yeah, you'd have to stop for a little bit.
Really? Okay, I'll do it for a week. 3 months, that's fine.
Yeah. You know, so that just puts you at high risk of complications. Yeah. You know,
have you ever had any complications with anything?
All surgeons have complications.
You know, with things like boob jobs, the aftercare with that, what's the recovery period? What do you have to actually really be careful of? Because I know I've seen friends who have had boob jobs and they're straight on airplanes or doing jobs and different things. What's the biggest thing that could potentially go wrong?
If boob job, you mean breast implants.
Yes.
So when you put a breast implant in, I use a tiny incision, about 3 centimeter incision under the breast. Okay. So
how the hell do you get the boob in?
You use it's amazing. You use something called a Keller funnel, which is like an icing piping bag.
Oh, for God's sake.
And you put it in and you squeeze it in. And the implants are really soft, so they go in through this tiny incision, and then they go in and then expand once they're inside. So they're really clever.
And how often does one have to, with boob jobs, how long do they last? Or it depends in terms of
So there's two aspects of that. One is how long does the actual implant itself last? I always tell patients that lasts at least 20 years. But then
it's a long old time, isn't it, to have that in there?
But the other thing is your natural skin and breast tissue around it. So the most common reason people have repeat surgery is because your natural skin has changed. Like if you go too big, or you have kids, or you know, your breast drops with time. So,
have you had people come in, get a certain size done, and then realise they regretted it and wanted something different? Yes. Really? Is that an easy thing to do, then change it over, or?
It's better not to do it. It's better to kind of get it right. But it's impossible to know, really, when you come for surgery as to what it's going to look like afterwards. Because we get patients to try on sample sizes in the clinic. So you can come in, you can put sizes in, you can say, oh, I like this size, like that size. We look at pictures. But very occasionally you have patients who, most commonly it's because they think they've gone too small. You know,
really?
Because you get lots of patients who are really cautious and rightly so. You know, they don't want to go too big, or they do a lot of exercise, and they come back in, and I say, how is it? And they say, it's nice, but I'm glad we went for the bigger out of the two, because when you have two, you know, I'll say maybe you have 250 or 300, say. How
many of them come in for a natural look, or out compared to how many come into a look? Because that's actually a thing, isn't it? People want to look like they've had stuff done.
Yeah, so I won't do that. So
you won't do that,
I would
really?
say, but 99% of my patients want
it's just all
a natural look and do it. 'Cause I think that's what I'm known for. I think people don't come to me for outrageous big implants, you know.
Porn star tits.
No, it doesn't. And that's not a thing anymore, you know. Certainly not
I
with my
don't think
patients,
it is actually, but I can't work it out. Are people going back to wanting to look slightly more natural, or?
I think so. I mean, yeah. I mean,
because
like
even the blowjob. Oh, you can't call them blowjob, but the big lip look is slightly changing. Well, we'll call them blowjob lips, won't we? Yeah. Yeah. Sorry.
I think that is changing. Yeah, their lips are smaller. You know.
But it's interesting, like, because everyone's ideal of what beauty is, isn't it? Like, you look at Marilyn Monroe and Audrey Hepburn; they weren't having filler and Botox.
No, and that's why breast reduction is my most common surgery I do now. You know, and it's sometimes quite a small reduction.
Yeah.
You know? So and it's more lift and shape. So smaller the breast, the longer it's going to last. As in, the better the shape, more fullness at the top. You know, the bigger breasts.
Do people ever come in and have things done to their nipples?
Oh yeah, so I do that a lot.
What's that?
So we do nipple height reduction.
Nipple height reduction? Yeah. What? Because of how far they stand out? Yeah.
So I had a patient. She was in church doing the collection in church.
Wait, say that again. So your patient was in church?
She was. Yeah, she does the collection in church.
Okay.
And had large nipples.
Why was she collecting?
So was concerned about.
In here, sir. No, sorry.
Yeah. So I was concerned about the height of the nipple, so we reduced that, and it's really common.
But isn't that a very sensitive area?
Well, you can do it in a way that reduces it, so you still have sensation.
Just chop the top off.
Well, so that's one way to do it. I do something called a top hat technique.
Okay.
So you basically take out the middle bit of the nipple and you scrunch it down, so you still have sensation. The ducts still work. I thought people
like the pert nipple look.
Yeah, but sometimes they're really long.
Too much. You could hang a hat on it. Yeah.
Can be like. Exactly that.
Interesting.
So you know so we do lots of so nipple height reduction, areola reduction.
Okay. And how does one do that?
Well, the thing with the areola reduction is often as part of a breast reduction you'll do it.
Yeah.
But if you patients say they don't like the size of that areola, you can reduce it by hiding the scar within the nipple,
right?
So within the areola, so you can you take it like a donut of skin and scrunch it down.
Ooh. What about designer vaginas?
So labiaplasty, do lots of labiaplasty.
But is that most common for post-baby? Or people just...
No, congenital, you know, again, asymmetry. So patients will have like one labia longer than the other.
Does it do anything to feeling down there?
No.
Nothing, it doesn't affect any of that?
People have filler there, so you can like put filler in the labia.
I've heard about this. That's a little
again,
odd.
I've not done, well, I put fat in a couple of times.
Really?
Which is like a permanent filler.
Yeah. What do you think the current trend at the moment is?
So smaller breasts for sure. You know, is much more common now than what it was 5-10 years ago.
What's the youngest you've had come in for a breast, any sort of breast surgery?
We can't do surgery until people are 18.
Yeah.
In the private sector, that's just the rules. So you have patients who've had significant breast asymmetry. But I had a girl, she was a hockey player, international hockey player with huge breasts.
Yeah.
You know, and really getting in the way. And it's quite a functional surgery, but we couldn't operate until she reached the age of 18.
Yeah.
But she had to play from, you know, she was fully mature, grown, understood exactly what was going on, had a very valid reason for having surgery.
Yeah.
But we waited until she was 18 and did a reduction on her.
Would you recommend people wear bras, or is it fine to not wear a bra if you don't need to?
Wearing a bra, particularly post-op, or in fact, any time.
I'm actually asking for myself because I fucking hate wearing one.
Yeah,
but I don't know if it offends people.
That's a personal choice, you know.
Okay, fine.
I think if you hate wearing a bra, that's fine.
But I'm not going to get saggier boobs from not wearing one.
You probably will.
What?
Yeah.
Excuse me, would you put my bra? But what, even if really?
Yeah, because if you think about it, what a bra does, it supports everything.
Yeah.
You know, and over time, gravity will stretch everything out, you know, even if you don't have large breasts.
Well, I'll be quitting smoking and coming to you. What puts you at high risk of potentially getting breast cancer?
There's lots we don't understand about breast cancer.
Yeah.
You know, the biggest thing is genetics. You know,
okay.
So obviously, if you have a strong family history of breast cancer, that puts you at higher risk.
Yeah.
Generally, the rule is if you have 2 female relatives on your female side who've had breast cancer, you are at significantly increased risk. We don't know if lifestyle changes and things like that increases your risk of breast cancer. There's lots of things you'll read about. I mean, certainly breast implants themselves have never been shown to increase the risk of breast cancer. There was a lot of discussion whether having fat transfer to the breast increased the risk of breast cancer.
So with fat transfer, it's different obviously to filler. If I was to have it, so I could get fat transferred from somewhere else just into my boobs.
So fat
is that dangerous?
No. Fat transfer is great if you want kind of half a cup size breast increase.
Oh, now we're talking. How much does that cost?
So you've got to have enough fat to transfer. That's the thing. So you have to have like quite a...
The inner thigh?
You've got to take a reasonable amount. And also you've got to have quite a tight breast envelope to put it in. So it works really well on top of breast implants. So I do a hybrid combination breast augmentation. So where we'll put a modest breast implant, so it's not heavy, and then we put some fat in to create a custom cleavage or bring the cleavage across.
Yeah.
fill the breast at the top. That's when it works best because you've got a nice tight place to put the
And where
fat.
else does one get fat injected to on their bodies? Everywhere from one place.
Hip dips is quite a common area.
The hell is a hip dip? I thought that was an exercise.
Is around the side here.
Oh, that thing.
So often women will have after abdominoplasty or and they'll go in and then they'll sort of go. So they go down like that, then out, and then in again.
Yeah.
And then out to the thighs, and you can graft that area.
So it just
really
goes
nicely.
like
so
that.
So you get a really nice curve. So you have a following curve from it follows the chest wall all the way down, then out again, and you can graft that area. That works really well.
Oh my god!
Facial fat transfer.
Facial fat.
Really nice. Instead of fillers, you can as people age, they lose fat from the temples across the top of the brows, this area. We can fat graft there.
It's a lot, isn't it?
Well, it's a permanent filler, right? So you don't have to go keep having.
And
fillers.
that lasts forever.
Lasts forever.
I'd never even consider that. And can you get it in your lips?
These
lips?
You can put it in the lips. The problem is if you put it in your lips and then you put on weight.
Back to blowjob
lips will get bigger.
I know what you're saying. Yeah, Christ. Okay, and now another surgery you do, which I have slightly been trying to get my head around, the corset.
So it's part of an abdominoplasty surgery, right? So typically after you've had kids,
it's not just a vanity, the beauty.
No, it's normally when you can do it without, like if you lost a lot of weight. So, but if the abdominal wall is lax and loose, like the muscles, the six-pack muscles, what you can do is tighten them up again. So you can do sutures down the middle, and that's pretty much what everyone does as part of an abdominoplasty.
Okay.
What I do is take it one stage further, and we do multiple layers of repair. And what that does is it really shapes the waist. So we do stitches down the side, it narrows the waist here, so it can help give you more of an hourglass shape.
Oh my God.
Usually combined with abdominoplasty and liposuction. So it's really, what it does is it reinforces your core. So improves back pain. And if you're weak at the front from having 2-3 kids.
Does one's body really, because you look at I've looked at certain friends who've had kids and their bodies don't go back to looking pretty similar to how they were before, and then some people's don't. Do your hips get wider? What actually does happen to your body?
So again, it's variable, right? So the fitter you are pre-op, as maybe also pre-birth, the stronger your muscles, the more that they're going to go back.
Bounce back, okay.
Typically, if you're young and like with the first child, it tends to go back quite well.
Quickly as when you're older,
It's if you have like 2-3 kids, each time it stretches a little bit more. And you probably, it's very hard to keep up in terms of exercise, keeping fit, once you've had kids and all of that. So typically it's the multiple pregnancies that can lead to slightly more laxity. But as you say, everyone's different. I had patients who've had abdominoplasty have another child and they bounce back really well.
Really?
Yeah, so it doesn't stop you having
That's quite good,
kids.
actually. What's the best thing that's non-surgical that one can do to keep the elasticity of your skin?
Diet, nutrition.
Yeah.
Don't smoke. All of these things
this non-smoking's cropped up quite a lot this conversation.
Yeah, I mean, it's people smoke and it's fine, but it's
what
more,
is the real? I mean, other than my sweet lungs, what is it actually doing to my skin?
So what smoking does? The reason I worry about it for surgery is it constricts the tiny blood vessels in the skin, right? So nicotine is a vasoconstrictor.
Okay.
So if you're doing a breast lift, you're reliant on the little blood vessels supplying the nipple.
Okay.
And if those little blood vessels are constricted, right, so there's no blood going through them.
Yeah.
And your oxygen carrying capacity of your blood is lower because you've got carbon monoxide and other substances in the smoke.
Yeah.
That there's not enough oxygen getting to your wound, so it's not going to heal well. And also it's the same for facial aging and the perfusion of the skin. If you've not got the oxygen and the nutrients going to your skin, your skin ages faster than if you do have the oxygen and the nutrients. So nutrition, collagen is great for skin healing and for general skin health.
Okay.
There's also lots of non-surgical treatments.
Well, actually, I was going to ask you because I've got a lot of messages from people asking what is the sort of list of non-surgical stuff one can do. So
Botox is great.
Yeah,
it works.
Quick one on Botox: is it preventative or is that a load of rubbish?
So I don't believe it to be preventative.
Yeah.
If you give Botox from an early age, what you do is you reduce the bulk of the muscles.
Okay.
So if you're not using your muscles, like your facial muscles, they're going to get less powerful, so you have less wrinkles.
Okay.
It's preventative in a way in that it's weakening the muscles, so you're not getting, they're not moving, and not getting the lines. But to start Botox at the age of 20, I think it's unnecessary. Botox,
do you? Okay, that's interesting. You said no because I remember when I first got it, I was about 28, and everyone goes, "God, you're late to the party," and I thought, "What?"
Yeah.
But I was young still.
I know.
You'd advise better.
But people go out and have it, don't they, from that age, and it's not something that does harm.
When does one physically stop growing?
It's highly variable. It depends on lots of things, how you react to the hormones, what your hormone receptors are, what your lifestyle is like.
Yeah.
Lots of things. But in terms of like, you see people whose height increases at the age of 19, 20 still.
Yeah.
Obviously, most people are done by then.
Yeah.
But it is.
No, I only got boobs
variable.
at 22, which is why at one point people thought I had a boob job. They're now fucking shrunk. But
like
anyway.
weight change will change your breast size, and like, particularly if you've got larger breasts over time, they'll continue to grow.
Yeah.
So you ask when people stop growing, the breasts will probably never stop growing if they're very large, because they're going to drop and get fuller over time.
Oh yeah, sorry, we were talking about non-surgical stuff. So
Botox is good. Skin boosters are good.
That's my favourite. Counteracts the mole bras.
Also, like fillers are good for sort of temporary boosting and filling of the skin.
Yeah.
There's lots and lots of non-surgical treatments. Generally in medicine, when there is like loads and loads of different options for it, it generally means there isn't one that works really well.
Yeah.
What we do is we always stick to things that work. You can spend thousands of pounds. In fact, I've had patients who spend thousands of pounds on non-surgical skin tightening.
What does that? What is that though? Like, what are you doing?
You don't see great results from it. At the very best, you see probably 5-10% improvement.
Okay.
I've had patients who've gone up Harley Street and they've spent
skin tightening where? Everywhere.
Yeah, potentially.
What are we doing? We're just.
Yeah, there's lots of techniques. So, you can treat the skin from the outside. So you can use like radio frequency from the outside.
Okay.
You can put things under the skin on the inside and heat it from the inside, which helps it contract. You could spend 20,000-30,000 pounds on it for 5% difference. And there's risks, I said with the facelift. If you had previous non-surgical treatments, then you come back to have a surgical treatment, it makes it a lot more difficult.
Okay.
So I would be very cautious about things. What we do is we always do things that work.
Yeah.
And I know I'm a surgeon, and I would say surgery works. Surgery does work.
Yeah.
So you see a big difference. I think if you're going to invest a lot of money and time and recovery, just do it properly.
So for weight loss, fat loss, what would be your recommendation if someone is looking to, because obviously now you can do liposuction, there's Ozempic, there's, do you know what I mean? A tummy tuck.
Yeah. So the number one thing to think about with that is, are you going to have loose skin afterwards?
Yeah.
If you've lost 30-40 kilos, right, you're going to have a lot of loose skin. There is no non-surgical treatment that's going to make any difference to that.
Okay.
And you want to get rid of it, you've got to cut it out, right? And cutting it out means scars.
Yeah.
So that's a tummy tuck. Liposuction is great for small areas and young patients. So patients probably under 30, under 35, who've got small pockets of fat. Liposuction works really well. If you're in your 40s, 50s, liposuction doesn't work that well unless it's combined with some skin removal.
And does it last? Like, so say I had liposuction on my legs, my legs will be fine, obviously, if I maintain diet and health.
Yeah, it lasts. Because your body has a finite number of fat cells that you're born with. When you put on weight, those fat cells get larger. You don't make more fat cells.
Oh, fine, okay.
So if you remove them with liposuction, you're removing a proportion of the fat cells.
That scares me, all of that poking about.
It hurts. Liposuction
I mean,
is
you're
sore.
asleep for this puppy, aren't you?
With me, yes.
Yeah.
But lots of people do liposuction when they're awake.
And
or with local
just explain to
anesthetic.
me, sorry, you're good people, you're in prodding like that, and that movement is really unacceptable. Sorry, it's a Friday morning.
So you have a cannula that's this long.
Yeah. Oh.
A narrow one.
Yeah.
And then you make a small incision in the skin, less than a centimetre. And wherever you can get to with that cannula is where you can suck. So there's a hole at the end of it.
You poke the wrong bit.
Yeah, you got to be careful. We do it when you're asleep, and you put lots of fluid in, so you basically blow out the skin with fluid, so it's safe.
Yeah.
So and it helps separate the fat. And there's different types of liposuction. It depends on. You need to go to someone who's knows
what they're doing. Okay. Oh, and fat freezing. Is this a thing, or is that any good?
So fat freezing is a thing. It's been around for a while.
Does it work?
It works on small isolated areas. So it works under the chin. Like maybe one or two small areas.
Producer Nat's happy now.
One thing. One or two small areas. What you can't do is fat freeze the whole body or the whole abdomen and expect nice results. And there are complications with it, as in some patients.
Burns. Can you get burns or something?
You get something called PAH, which is basically where you've had the cool sculpting, and actually that area grows. So you paradoxically produce more fat in that area.
What happened to that model?
So she had that.
Is that what? Okay, so
yes.
She had it where, on her face or on her?
I don't know. I can't remember exactly where she had it, but I think what happened is she had this treatment, and then it basically caused the fat to grow rather than shrink.
Oh, I'd go fucking mental if that had happened.
Yeah. So I've seen patients who've had that, and they come back and we do liposuction.
It's risky, isn't it?
There's nothing without risk.
I know. But
that's always the thing, and you just have to be aware and keep your eyes open to what's that, and make sure that you are fully informed about what's happening.
Yeah.
And don't go to like some backstreet place and have a facelift by someone for like 200 quid.
With a dodgy knife, and no, I know
you have to be very careful. But people will do it because they don't have the money and they want to.
Do you find it highly fucking irritating that there are people out there who don't like the rules and the regulations on having facelifts? There are dodgy doctors that are just performing this stuff.
It is annoying, yeah. I mean, there are regulations for doctors, so you have to be a member of the GMC, and there is regulation.
But so whoever did the Brazilian bum lift on the girl who's died, has he been arrested?
But he wasn't a doctor. But generally, if you're a doctor, you are, you've gone to medical school. If you're a doctor, you've gone to medical school.
Yeah.
You spent 5-6 years of your life training how to look after people in all aspects of it. So if you have a complication or you have a problem, you know how to deal with it.
Yeah.
The problem is the regulation around fillers, because fillers is a non-prescription medicine.
Yeah.
You can buy it off Amazon, and you can just inject it yourself, and who's going to stop you?
Oh my god!
Obviously, there are rules like against grievous bodily harm, and it's common assault if you inject somebody and they have a problem.
Yeah.
But it's very woolly, and that's the problem in the UK. In Australia, it's a lot stricter, as in only medical professionals are allowed to inject and treat people with fillers and things like that, and that's how it should be here.
Well, what's a day in the life of Dr. Dan, start to finish?
So day in the life would be either clinic or surgery.
Yeah.
So generally I operate 3 days a week and have clinic 2 days a week.
Okay.
So clinic is kind of 8:30 to 6, half an hour slots or an hour if necessary for new patients. And then operating is 8 a.m. to 6 p.m.
What's the longest surgery you do?
I used to do bilateral breast reconstruction. So we bilateral DIEP flaps. So you take the abdomen and you build 2 new breasts from it. That would take probably 6-8 hours.
And you don't get a little ciggy break? Not a ciggy break, but just a little break in between?
You work in a team. So but generally there'll be bits where you do the bit, and there's other bits where, the other in the NHS, you have work as a team. So other people will sew up the abdomen.
You take one tit, I'll take the other.
So that's generally the longest. But privately, for aesthetic or basic reconstructive surgery is what we do. I would always keep the surgery under 6 hours. Because if you go above that, the risk.
I've had a few questions come in that we'll just do quick fire. Loose skin on the tops of arms. Do you get it removed or just learn to live with it after weight loss?
So very much depends on what you're willing to accept. So 2 ways to do an arm lift. One is with a big scar along here.
Yeah.
Okay, if you have a lot of loose skin, you've got to have that. The other way is a short scar arm lift. So if you only have a little bit of loose skin, you can just put the scar up here and it's more hidden in the armpit. How
difficult is it to do nipple recon during an uplift? Do they always look rubbish?
So there's always a scar around the outside of the nipple with an uplift. Do they always look rubbish? I would hope not. I mean, they look like a nipple with a scar around it. Yeah. But it depends. You try and make them nice and round. And it's what you can do afterwards, once it's all healed, is you can get a tattoo. So you can.
Oh yeah, these look quite amazing. Actually, I've seen this on Instagram.
They're incredible. So actually, you can do it. So it looks like you've not had surgery.
Yeah.
I have had patients who, in fact, at sort of 2 years post-op, you can't see their scars around the nipple, whether they've had tattoos or not.
You must be a very good surgeon.
So.
Nose filler or nose job?
Depends what you want to change. Filler works quite well just on the top of the nose here, but if you want to change the projection or rotate it, then you need surgery.
Best non-invasive anti-wrinkle treatments for older women?
Botox, always.
Botox.
And only Botox.
Getting upper eyelid surgery, but should I get it done from a surgeon specialising in eyes?
Get it done by a surgeon who does a lot of them. Don't get it done by someone who does
Don't go up to wherever that woman is behind the restaurant.
Yeah, but also, don't go to someone who does. Don't go to somebody who has does 3 or 4 a year.
Go to a proper. Just what should one look for when they're looking for a good surgeon? What's like the 5 best things that you suddenly go, okay, that's the one?
So experience.
Yeah.
Being accredited, so being part of the professional membership. So obviously GMC register, proper training, having done the FRCS PLAST, which is a plastic surgery specialist exam.
Yeah.
Being a member of BARPS, BAPRAS, which are our professional bodies. You can't go far wrong with those if people are accredited to that. Don't go to somebody who doesn't have a surgical training.
Yeah.
Is not on the specialist register for surgery.
Do you think it's a good thing or a bad thing that celebrities are naming and not shaming, but just naming their surgeons?
I think it's a good thing. It's open. It's much better to be open about what's happened because although the best surgery is people know that you don't know that the people have had surgery. Equally, it's pretty obvious when someone's had a breast implant.
Yeah, can I be honest? Why does it look more obvious on men though? Men, for some reason, it doesn't look the same way that it does on women. Like, you look at Lindsay Lohan, she looks fucking phenomenal. Yeah. Saw her in the flesh last night, unbelievable. But then there's other celebs, male ones, who look a little bit peculiar.
Yeah, because I think sometimes men overdo it. You know,
Yeah,
you
which is interesting actually, considering.
And also very important. Lots of men don't follow the post-op instructions. So
Of course they don't.
No, you know, like
They
you
follow
guys are
them
back in the
generally.
gym. And I've had patients who had massive gynecomastia surgery, man boob.
Sorry?
Who've had man boob removal. You know.
Oh, the moobs, yeah.
Yeah, and they're in the gym the following day. You know, and I'm specifically say do not go to the gym until at least 4 weeks after you've had your surgery.
Yeah.
And they don't do what commonly don't do what men are terrible for doing what they're told. You know,
Yeah,
so.
you can say that again.
But also, also male facelifts and things. It's more difficult to hide the scars. You know, men
Is
don't tend
men's
to wear their
skin
hair
just a
down.
bit tougher?
It's sometimes a bit thicker, and also you have the hair follicle. So if you've got a beard,
Yeah.
or where your stubble is, if you do a facelift, you tend to remove that. So you end up stitching the hair-bearing skin up to the side of the ear because that's where you remove the skin.
Oh my
so
God, then you've got hairy ears. That's
can't have that.
perfect.
So you've got to be so.
God, aging's just not great, is it?
You know, so there are many reasons really why women sometimes do better than men.
This has been fascinating. Thank you so much.
You're welcome.
Anyone actually listening, make sure you do your due diligence and where you're getting your work done. If people would like to come and see you, where can they find you?
So I work from central London. My company's called the Plastic Surgery Group. I work with my colleague and we do lots of non-surgical treatments as well as all the surgical treatments.
Thank you so much, Dr. Dan Marsh.
Thank you.